What we're talking about today is very interesting because I was scrolling through the nursing subreddit and I saw a nurse that had a question about, can COVID be contracted through blood? And she said she's been seeing a lot of patients coming to the hospital refusing to get their blood because they're afraid they're going to get COVID through their blood transfusion. From what we know today, you cannot contract COVID through a blood transfusion. Now I'm going to get into the details of that so that you could understand the risk. In my opinion, as a nurse, I think that if you have a hemoglobin or a blood count of 3, and where your blood count should be anywhere between 10 to 13, then your risk of getting COVID through a blood transfusion is a lot less than the risk of you not getting that blood transfusion that can save your life. We're going to talk about the studies behind the risk. So let's get into this. So first of all, extensive studies in blood supply monitoring show that there are 0 confirmed cases of COVID-19 transmission through transfused blood. Why? Because SARS-CoV-2 is a respiratory virus that spreads through the respiratory tract, through the lungs and the airway. Blood is not the usual form of transmission for this virus. This may be where the concern is coming from, because although scientists have found the viral RNA in rare donor blood samples, they could not culture the live virus from those samples. What that means is that in order for you to get the virus, it has to be in an environment where it can stay alive. We know that this happens in the respiratory tract. So while medical systems remain vigilant, the conclusion is that blood transfusions remain safe regarding COVID-19. If you're worried about this, you want to talk to your healthcare provider, but so far it's reassuring.